Hello, and welcome to another episode of Your Health, Wealth, and Happiness. The seasons are changing, and we all know what that means. Allergies. What exactly are allergies? What is the difference between seasonal allergies and regular allergies? We're about to find out. Joining us is Dr. Sadiq. Welcome back, Doctor.
Thank you. Pleasure to be here with you, Brittany.
Well, as always, we love having you. All right, so let's get started. What exactly are allergies?
Actually, allergies are the reaction of the body. Certain things body takes it as foreign objects and body quickly react to it. And they say, oh, it's not good to have these things in the body. So that's a reaction that can be certain things like even the peanuts or all the things which body is taking them as not suitable for the body. So this is the immune reaction. Body start making the antibodies which fights with those things which body is considering as foreign objects. So the reaction, we call it allergies. So it's allergic reactions.
Okay. And what are some of these common allergies or allergens?
So that can be very common is dust. That's very, very common. And also animal danders, pollens, that's very common. We call it seasonal allergies. But on the other hand, we have a lot of people who have food allergies like fish, shrimps. That's really also very common. Peanuts is one of the very common allergies in children. Other than that, you have egg. Some people cannot take egg. Milk, which is very sad thing. A lot of people have milk allergies. Also, which one thing which is very, very dangerous is stings, bee stings. That can be life-threatening also, because if I get a bee sting, maybe my reaction is not that harsh, but certain people, if the bee sting, I know a person who has a 2-year-old child, and if he gets a bee sting, his whole body swell up and red, and he gets short of breath. So we call that as kind of anaphylactic shock. So that can be life-threatening, and some people have those. So other thing is latex. A lot of our gloves have the latex in it. So in the health field, when we use the latex gloves, some people cannot tolerate the latex gloves and they can get latex allergies. So that also can be very, very dangerous.
Oh, wow. So can any of these allergies be cured then?
Unfortunately, no. We do at times build some sort of immunity in the system, which can handle these allergens in a better way. But if you ask me, is there any cure? I would say unfortunately no, but we can actually prevent these things. That not like 100% curable.
Well, speaking of treatment, what treatment options are out there for people who suffer from allergies?
I think we have to, first step is that which is the most important, viewer should know that avoidance is the key. You have to avoid the allergens. So whatever you think, that if you can recognize that this is certain items which are causing the allergic reaction, please avoid those. That's the most important. Aside from that, we have some immunotherapy, and also we have epinephrine, which mostly people know as EpiPen, which epinephrine can be actually helpful in the quick treatment.
I know a lot of people who carry around EpiPens in case of their allergies flaring up. Can you explain a little bit about what an EpiPen does for them?
Actually, EpiPen contains epinephrine, which is a life-saving medication. When someone is having severe allergic reaction and needs immediate care, an EpiPen can be injected into the thigh to lessen the symptoms until the person can receive the medical care they need.
Okay. And not all allergies are that serious though, right? How can you tell if you're having a serious reaction to your allergies?
Yeah, all allergies are not serious. Some like seasonal allergies, we call that's not very serious, but some allergies are life-threatening. It means the reaction is very, very severe, and we call that anaphylaxis. That means that people can actually lose lose consciousness. They stop breathing at times. The people can many times have seen that they are resuscitated because they kind of really can be that dangerous. We call it cardiopulmonary arrest. It means that heart stop beating and person stop breathing. That can happen if the allergic reaction is very, very severe. One of our friend who was allergic to shrimps, and he didn't even eat the shrimp. He just ended up touching the shrimp, and he got into this reaction. He ended up dying with this anaphylactic shock. So it's very sad. So avoidance is very, very important. You have to avoid if you think you are allergic to something.
That sounds very scary, and I'm sorry for your loss. Now that we know what we can do if we have an allergic reaction, how do we know if we are allergic to something? How do we find out if the allergens we're affected by?
Actually, there are some tests available. Please see your doctor. The doctor can test you, especially if the primary care doctor cannot help you, then there are specialists available. We call it allergists. So they can actually test you. We have some skin tests available, some blood tests available. They can find out whether you're allergic to something. But in my experience, at times they have limited tests, but still sometimes they are not able to recognize the allergen. That is also an unfortunate thing. But most of the time, like common allergies, they are sometimes able to recognize it.
Oh, great. Let's talk about some of those common allergies. Are there any home remedies that we should try to be using?
Actually, yes. For seasonal allergies, which are not life-threatening, it's like pollen. You start having runny nose and tearing of eyes. That sometimes we call it not that bad of the allergies, and many people get a certain time of the year. So for those, you can use nasal saline irrigation, or you can use antihistaminics. That will help you. Sometimes you have dust or pet dander. Those are very common allergies, and you do simple things. Wash your bedding, keep your house clean, make sure that you do simple steps to avoid those major reactions. So pick up when it starts. So you can do simple things.
Absolutely. Well, you bring up a good point about being allergic to pets. Animals tend to shed a lot. Is there anything that we can do to further prevent having allergic reactions to our furry friends so we can keep them?
I think it's very, some people have a little allergies. They will start having it's not a full-blown allergic reaction. So for them, they can definitely have pets, but make sure you keep your floor clean. Maybe hardwood floor is better choice than carpet. Maybe leather sofas are better than the cloth sofas. Keep your house clean, and maybe the pet area should be not everywhere, in a little bit of a designated area where pets stays there, so you are not having the pets in whole house. So it's difficult to clean the whole house, but it's easier to clean one area, and pet should be, I've seen certain people have a designated area for the pet. My own house, my mom used to have a designated area for the pet. So because of my sister, so she will have the dog, cats in one area. So we can do that. That's easy fix. So still we can see the pet from far.
Yes, no one loves a good furry pet. Okay. Well, that definitely helps. Lastly, it seems that everyone has some form of allergy. How many people are affected by them?
You would not believe it's such a common thing. Maybe 50 million people are suffering from allergic reactions, and in America there is 32 million people who suffer from allergic reaction.
Wow.
And 1 in 50 people, they get a anaphylactic shock, anaphylactic reaction. So it means that 1 in 50 out of those 32 million people suffer from a heavy allergic reaction. So it is very common. It doesn't look that way, but it is very common.
That's certainly a lot of people. Thank you for being with us here today, Doctor, and sharing all this information.
It's my pleasure.
And do you have anything else that you would like to add for our viewers?
Actually, I would advise that it is very important to take care of yourself, and you watch your body, you watch your surrounding. It's very important. I tell my patient, you are your own doctor, because you see yourself every day. I see you here, once in a while, but you see yourself every day. So watch what is bothering you. Watch what is causing the allergic reaction. because avoidance of those allergens are the key. And then see your doctor and give them all the details so they can do some tests on you, so find out what exactly allergens are. And that's very important. We don't want anyone to have the severe reactions. So if you find out that yes, you are allergic to certain things, then keep EpiPen with you, keep antihistaminics with you, and take care of yourself.
Well, thank you, doctor. And until next time, viewers, stay healthy, happy, and live better.